Good evening, everyone. Thank you very much for joining us for our webinar tonight. Just firstly, apologies that obviously this webinar was due to originally go out last week, but we had to postpone it. I'm sure you can appreciate at the moment things are changing very quickly, and of course we want to bring you timely advice, correct advice, obviously in a timely fashion. So thank you for bearing with us. And thank you for joining us again tonight. With me tonight, I have Mark Lynett, who will be doing our introduction, Chief Executive of the NPA, followed by Helga Magnon, who will be doing a policy update and also giving us an update from Keith Ridge's webinar that she's just been listening into. Then we have Shaf, who will be going through the main body of our presentation, and then we'll be opening to Q&A at the very end. I'm just going to take you through some housekeeping very, very quickly. So first of all, this is a web-only service, so all the audio will come through your computer. If you do have any problems, then there's a little question mark in the top corner, which you can press. It'll run a quick system test and tell you and identify, hopefully, if there's any problems. But just, yeah, refreshing tends to iron out. If you do have problems and the refresh button doesn't seem to be helping, there's a little status bar just below the slide and the presentations. If it says connecting, then try the refresh button again. It should get you back on. If it says playing, then it could be your volume level because you should be hearing the presentation. But just go through and make sure there's nothing in the background that might be taken away from the ability for your computer to play that sound. Throughout the presentation, we welcome your questions, so please do send them in. We have a team of colleagues in the background. We have Kush Patel, Janice Patel, and who are from our learning development pharmacists, and they will be there to answer your questions, as well as Helga and myself. And also, if you have any technical problems whatsoever, then please do send those through the platform and we'll see if we can help you as best we can. And we also have Anne McAllister, our representation manager from Northern Ireland, and Janice Oman from Scotland, who are also there as well for you. So without further ado, I will pass over to Mark for his introduction and welcome. Thank you.
Good evening, everyone, and thank you for joining us for tonight's webinar. We're going to be talking about the deployment of volunteers, particularly in the context of COVID-19. Now, I realise some of you probably already watched one webinar tonight, the Keith Ridge webinar with NHS England, probably on top of a long day at work. So I do hope everyone's managed to get some food, to get something to eat and a cup of tea or whatever, and we're ready to go. So I want to start by thanking you all and indeed all of our members for your continuing dedication to patients as this crisis continues and evolves. We know that you must be at the limits of your resources and your stamina, but somehow amazingly remain committed to the health of the nation. So thank you from probably everybody. Now, and as you know very well too, pharmacists and pharmacies don't always get the recognition you deserve. That's why I'm so pleased to say that over the last 3 months, the national media is actually waking up more and more to what you do. The NPA has spoken out for pharmacy over 80 times in probably 15 or so different national channels over that period. So BBC, ITV, Sky, Daily Mail, The Mirror, Sunday Times, etc., etc. So that's really good. That's really good. Now, so today's webinar, we're going to support you with the recruitment and the proper use of volunteers, including using volunteers to deliver medicines. Both the NPA and our insurance company, NPAI, want you to have the confidence that we'll support you through unprecedented times, as everyone keeps saying, so long as you're taking a structured approach and you're following the guidance. Now, I'm sure we're all massively grateful nationally for the hundreds of thousands, is it nearly 1 million volunteers who've come forward nationally. And of course, those volunteers can help free up pharmacy staff by performing all sorts of non-clinical tasks, such as security and janitorial duties. However, in terms of volunteers helping make medicines deliveries, that requires more detailed thought And it's one of the things that we're going to touch on in the webinar tonight. So what are we going to cover? Well, we're going to go through the NHS Responder Scheme. We're going to go through how to recruit a local volunteer, procedures that you need to be followed when you're using that volunteer, and all sorts of questions around using volunteers to deliver medication. And of course, indemnity insurance, all those sort of questions about the use of volunteers in the pharmacy and for delivery. So the webinar doesn't stand alone. We're producing a whole suite of NPA resources to go alongside this, which will give you further information about the legal and the ethical boundaries, amongst other things. Now, before carrying on with the main event, can I remind you that on Monday we published the Easter opening hours pack, and this includes some editable posters. So I hope everybody found those useful. We're going to continue to update the pack, obviously, and all the other resources as we get more information that we can share with you. And finally, for me, I want to assure you that we are continuing to work really hard behind the scenes to persuade government and NHS officials to step up their support for community pharmacy. We're making it clear that if you want to keep vital pharmacy services going, you need protective equipment to reach your pharmacy teams without delay. You need access to testing for your teams, and you need real funding to cover your vastly increased costs. Only if these are there will it allow pharmacies to keep the doors open and continue giving patients the support they need on the front line. So thank you once again on behalf of the NPA. Stay safe, and now I'll hand over to my colleagues.
Hello, good evening, everybody. I'm just checking that for sound, that you can hear me okay. As some of us, those of us in England would have heard a few updates, so I will not be duplicating much of what we have already heard. But what I'd like to take you through now are just a few key updates and re-emphasizing a couple of our policy statements. So we already know, we've already mentioned several times that, again, Mark Linus probably will talk to us about that later. We are obviously canvassing governments UK-wide across, sharing our concerns that we have from our members. Notably, we are talking about some changes to ease the burden of some regulations, some maybe changes to things around verbal consent as opposed to written consent. We're asking for easing of non-time dependent requirements of the contract. We've already started to see some of those. We've also asked for flexibility on some pharmacy opening times, and again, we've seen some recognition of those. And we've also asked the recognition of pharmacy staff as key workers. But at last, I think, after a couple of weeks, we now have got it properly established. However, if you feel that some of your teams are still being challenged on their way into work, please do let us know so we can continue to reiterate that there's a bit of an issue going on. Needless to say, the stuff obviously we are talking about mostly is around the funding, and on that basis, we do encourage you to continue to fill in the survey, but also to log any COVID-19 expenses that you are incurring from anything at all, really, which I'll talk about more about later. We do know also last week that Public Health England updated its guidance, and it did mention community pharmacy for the first time. Now, we do know now that masks should be worn, particularly in areas where the 2-meter social distancing cannot be maintained. Obviously, naturally, that is in most of our pharmacies. But we have had it confirmation earlier today, for those of you who weren't able to hear the webinar in England, that wholesalers have been given further supplies and should be having them with them from tomorrow, is that we were told. So the instruction is in England to order from your regular wholesalers. At this point in time, it is going to be a cost to us, the NPA members, the contractors. However, do make notes of that because it is recognized that it is a COVID-19 expense. I will then, obviously, if I could signpost you to the website We also have some updates from England, Scotland and Wales, where we recognise that allocations will be delivered to you over the next few days, if not already. So also we have seen Perspex screens, and again we have seen a £300 contribution towards the cost of Perspex screens. We've also been told that COVID-19 testing is to start. We realise that community pharmacy is somewhere there, but we're trying to establish exactly when and how community pharmacies and their teams will be tested. More of that we will keep you posted onto our webpage. We've also had some updated on the GPHC PSNI guidance around supervision. I'll talk about that later. And the pharmacist pre-registration assessment, as already mentioned to you last week, they have now been postponed. They won't be sitting their exams, the June or the September exams, and the GPHC will be having discussions as to what assessments or what would take place to, I suppose, recognise that these students, pharmacy pre-regs, haven't taken an exam yet. I also have an update from regard to pharmacy students, where we understand there will be some policies coming through centrally in how we are able to use pharmacy students when they finish their exams. These are undergraduate students who are due to finish their exams at the end of May, and the process that we will need to follow for us to be able to make use of these students. Potentially they could volunteer into our pharmacies. So the two policies that I wanted to reiterate is one around the volunteer policy and the other one is around the supervision. So in essence, as far as our volunteers are concerned, we welcome the generous offer of volunteers who can help free up pharmacy staff by performing non-clinical tasks such as security and janitorial duties or any other operating tasks, if you like. However, with regard to volunteers making medicines deliveries, we do require further detailed thoughts on this. And we are in discussion with the government, the pharmacy regulators, professional bodies on this regard. In regards to the volunteer drivers service, we have also heard in England from the webinar earlier this evening that this can be used through the SAM app, but also at the same time, we understand that tomorrow we will see the launch of the new Delivery Driver Advanced Service. So we are informed that this will be through two parts, an essential service and an advanced service. The essential service will be for us, the pharmacists, to ensure that medicines are delivered to those shielded populations. So these would be the 1.2 million. So it's not everybody, but it's 1.2 million. And the advanced service would be for those who wish to take it up. And we will be paid for a delivery that will take place for these particular individuals. Again, details as to what this looks like and the cost, the service specification, any guidance and so forth, we understand will be published tomorrow. As soon as we get that, we'll be putting it directly onto our NPA COVID-19 webpage. So we understand there'll be some guidance, but also my colleagues will be able to provide any further assistance through the usual pharmacy services line, if you like. So, as I said, we just need to look and understand a bit more what a driver volunteer actually looks like. But in the meantime, in England, you will have an advanced delivery service that you can avail yourself. In regard to supervision, the policy has not changed. We still require responsible pharmacists to be on site every time we have services taking place within the community pharmacy. It is important that they use their professional judgment to assess any risk to the delivery of safe care to our patients. We have had some guidance issued on the 18th of March, and today we've had some further guidance from the PSNI in support of this, which basically outlines a bit more guidance as to how we can continue to work under these conditions, particularly under COVID-19. So in essence, the policy has not changed. You still need to have a responsible pharmacist on site who would be able to intervene in the sale and supply of medicines. So that's all the policy updates so far, and of course I'll be available at the end to take any questions in that regard. Thank you, Simon. Over to you.
Thank you very much, Helga. That was fantastic. Thank you. Okay, I'm now going to pass you over to Shaf, who will be doing the main body of our presentation for you today. I will play that to you now.
Hello everyone, and a warm welcome to today's webinar on delivering medicines during the COVID-19 pandemic. My name is Shaf and I will be delivering this webinar to you today. Before we get started, please ensure you have a strong internet connection and if possible, use headphones to listen to the audio. If this is not possible, please make sure you are in a quiet environment and turn up the volume of the speakers. The presentation will be displayed on the screen in front of you. You may need a pen and paper to make notes during the session. However, this is a recorded webinar and you'll be able to view it again later. After viewing this webinar, you will have a better understanding of the following: how to recruit and use volunteers within your business, how to use the resources that the NPA have available during the pandemic, how to train volunteers and staff to deliver medicines, how to remain within legal boundaries during the pandemic, and how to adapt the pharmacy environment. Whilst reading the guidance that we provide, please be aware that we expect members to follow the law at all times and only consider working outside of the law when all other options have been exhausted. However, we recognise that there may be circumstances where, in the best interests of public health and patient safety, the pharmacist has to make a decision outside of expected normal practice. The General Pharmaceutical Council and Pharmaceutical Society of Northern Ireland have issued guidance to support us during the COVID-19 pandemic. The first concern of registered pharmacists and pharmacy technicians is the care of their patients and people who use health and social care services. It is important that they use their professional judgment to assess any risks to the delivery of safe care, informed by any relevant guidance and the values and principles set out in our professional standards. Where a responsible pharmacist decides to make a judgment call, they should ensure that they are able to justify why they have made the decision and demonstrate that they did so with the necessary precautions in place to minimize risk. Contemporaneous record keeping is strongly advised in the event that the pharmacist is called upon to justify their decision at a future date. This flowchart gives you a nice visual summary to show you which resource may be most relevant to you when thinking about training your staff and volunteers during the pandemic. Please be aware that I will be focusing on the volunteers that the pharmacy hires themselves throughout this webinar, not NHS volunteers responders. This is a separate scheme which I will briefly touch on in the coming slides. These are examples of the types of resources you can find on the NPA website, amongst others. Each document focuses on a specific element regarding staffing during the pandemic and has been created with the help of existing guidance from bodies such as the NHS. There is some overlap between the resources. It is important that you read the guidance which is directly related to your needs. For example, if you need to know more about how to use volunteers within your pharmacy during the pandemic, you would find it useful reading a guide to selecting volunteers. These are the 3 guides that are available for volunteers and pharmacy teams. The Pandemic Training Guide for Volunteers is a document that provides guidance for volunteers who are hired to work in the pharmacy. It provides a basic outline of particulars within a pharmacy, for example, the concept of patient confidentiality and standard operating procedures. It also gives a brief overview of COVID-19, the do's and don'ts during the pandemic, and an outline of the tasks that they may be asked to help with during their time in the pharmacy. The second 2 guides you can see on the screen are both aimed at pharmacies and pharmacy staff. The guide in the middle is aimed at owners, superintendents, and responsible pharmacists. It provides guidance on topics such as training for volunteers, recruiting volunteers, how to minimize risk to patient safety, and delivering medicines using volunteers. The final guide, the Pandemic Training Guide for Pharmacy Teams, is similar to the one for volunteers, but this one is aimed at members of staff in the pharmacy. It provides a more in-depth look at how staff should conduct themselves during the pandemic. Once again, there is a brief overview of COVID-19 and the advice that should be given to patients about the virus. It tells you how to keep yourselves and the public safe during the pandemic, and also provides tips on how to manage the pharmacy environment. Moving on to some delivery resources. These two resources are targeted towards volunteers who are used for the purpose of delivering medicines. The standard operating procedure should be read by every volunteer who is hired to deliver medicines, as well as contracted delivery drivers. It provides guidance on steps that should be followed when delivering medicines during the COVID-19 pandemic. The Delivering Medicines fact sheet provides an overview of the delivery process and the resources that a volunteer may require. It also contains a list of questions which the volunteer may have. They can use the answers to these as guidance when delivering medication. So what can volunteers help with? These are examples of activities that a volunteer may get involved with within the pharmacy. Ultimately, it is the responsible pharmacist's decision as to what they allow a volunteer to do. They should utilise them in areas which they need most help in. Patient safety and well-being should always be considered and prioritised before making any decision regarding volunteer duties, and a volunteer should only carry out a task if they are deemed capable to do so. So what can volunteers not do? This is a list of activities that a volunteer should not help out with. Essentially, any activity which involves handling medication or advising on medication in the pharmacy should not involve a volunteer. So this includes things like dispensing medicines, providing medical advice, handling medicines, handing out checked medication bags, selling medicinal and medical products, and also tasks not signed off for them to carry out by the responsible pharmacists. So if we focus on handling medicines, just be aware that this includes OTC sales, putting away or picking dispensary stock or P medicines, and also taking back waste medicines. All of these tasks require the individual to have completed or to be working towards a GPHC accredited course. You should ensure that you have a referral pathway in place so that the volunteer knows which member of staff to refer queries to. So when should you use a volunteer for delivering medicines? As a first stop, you should try to use a person who is working towards or has completed a GPHC accredited delivery driver course, such as the NPA's Delivering Medicines Safely and Effectively course. This would usually be the regular delivery driver that the pharmacy employs. If the delivery driver is not available, for example in cases where they might be self-isolating, the pharmacy should try to use a qualified member of staff to make deliveries. The graphic on screen shows a flowchart on how to consider which members of staff should take over delivering medicines. Using volunteers is a third option and should only be considered if the first and second options are not possible. Now, we understand that in order to cope with delivery demand at this difficult time, pharmacists may be forced to consider alternatives if they no longer have the staff to deliver medication. At this point, you would have to rely on volunteers to make deliveries. Volunteers can be local groups in the community, such as church groups, or they can be recruited from the NHS England's Volunteer Responder Scheme. These two are different things. The NHS Volunteers Responders are being coordinated through Good Sam and the Royal Voluntary Service. You would have to ask for them to support you in your deliveries, and a suitable volunteer in your area would be assigned to you. If using a volunteer through these channels, you must follow the corresponding guidance along with the relevant NPA documentation. This may be very difficult as you would not have been part of the initial vetting or recruitment process. It is important to note that these drivers will not only be helping multiple pharmacies deliver medication, but may also be helping patients who are in self-isolation. They may be helping with tasks such as shopping or transporting patients between places. In the next couple of slides, I will go over the factors to take into consideration when thinking about hiring a volunteer in the pharmacy. Please be aware these are not NHS volunteer responders. This slide provides a brief overview of how volunteers are being coordinated outside of England. In Scotland, community reserve volunteers, the equivalent of volunteer responders, and local health boards are trying to decide the best way forward with regards to deploying volunteers. They are being coordinated by readyscotland.org. The Community Development Health Network in Northern Ireland are supporting the volunteer programme through the Health and Social Care Boards. They will have Access NI checks carried out. These are equivalent to DBS checks in England. Wales are looking into using family members or neighbours of patients to pick up medication on their behalf. If this is not possible, contractors may have to arrange delivering within their current delivery arrangements for existing patients. If neither of these options are suitable, they are exploring the possibility of creating a volunteer network across the country for pharmacy to deliver to extremely vulnerable persons. If you are in any of these countries, we suggest contacting your local health board for more guidance. Moving on to recruitment of volunteers. We suggest doing a risk analysis to determine whether a member of the public is suitable for delivery of medication. You will need to think about the background of your volunteer, as this may affect their suitability. For example, someone with previous work experience in healthcare may be more suitable than someone without any previous exposure to a healthcare setting. Once the owner or superintendent pharmacist or responsible pharmacist is satisfied that the member of the public is suitable, there should be a robust protocol in place so that the pharmacist can demonstrate why they have made the decision to allow a member of the public to deliver and how they have ensured that the risk in this was minimized. This flowchart is an example of a protocol that could be implemented. I will be going through each of these steps in the slides that follow. So step 1, screening a member of the public. At this stage, the owner or superintendent pharmacist or responsible pharmacist will have to ask questions and determine whether the person is suitable and that they have the right intentions. You will need to carry out a DBS check or equivalent for insurance purposes if the volunteer is going to deliver medicines. This will be covered a little bit later. If the person is delivering items to patients, they should have access to an appropriate vehicle. You should make sure that the vehicle can be locked and it should be in an appropriate state to deliver medicines. Step 2 involves proof of identification. As with any recruitment process, you should attain at least one valid form of photographic ID from the volunteer. This can be things such as a driving license or a passport. Please be aware of property such as bank cards or shopping cards, which do not count as valid forms of ID because technically they can belong to anyone. Once you are satisfied with your volunteer's ID, you should set in place a process to teach the team about the requirements of their role and where their limitations lie. This can be achieved by signposting them to documentation that I spoke about earlier, such as the SOP for delivering medicines and the pandemic training guide. As mentioned previously, it is really important that your volunteer is aware of the referral pathway in the pharmacy, so they know who to refer any queries that are outside of their scope to. Once the volunteer has understood the requirements of their role, it is important for them to receive the relevant training. In addition to the specifics of their role and essential legislation such as patient confidentiality, it is important to train them on the extra precautions that they should take during the COVID-19 pandemic. Examples of this can include social distancing protocol and regular hand washing. The final step of the process will involve the volunteer signing a volunteer agreement form. This can be found in the guide for selecting volunteers. The volunteer will sign and date to acknowledge that they have understood all the terms of the arrangement listed in the form. For those delivering medicines, a DBS will be required. In the last couple of slides, I will discuss the steps to follow when hiring a volunteer to help with your delivery service. As mentioned towards the beginning of this webinar, you may need to rely on volunteers to deliver medicines to your patients as a very last resort. It is important to highlight that delivering medicines can be classed as a high-risk activity, and the overall responsibility will lie with the responsible pharmacist. They should take into consideration factors such as fraud, misrepresentation, and delivering to potentially vulnerable patients. This flowchart on the screen shows the steps that we recommend you follow. Please note that these are in addition to the 5 steps that I just went through. As delivering medicines can entail several different elements, it is important to train your volunteer in line with your delivery protocol. This will include specific things related to the delivery process, such as how to carry medicines in transit, how to deliver to different groups of people, and how to maintain patient confidentiality whilst delivering. In addition to the guidance that we have made available to you, you may wish to signpost the volunteer to your pharmacy's SOP for delivering medicines. This is to make sure that you have covered all the necessary points thoroughly. patient consent. So when using volunteers to deliver medication, it is important to make your patients aware that their medication is being handled by a member of the public who has volunteered to help with the delivery service. The patient or a representative of the patient should give verbal or written consent for their medication to be delivered by a volunteer. This should be dated and recorded on the patient's medication record. It is also a good idea to alert the patient to the fact that if their bag arrives unsealed and they suspect that it has been tampered with, they should phone the pharmacy immediately. And finally, when handing over the medication for delivery to your volunteer, they should sign a delivery sheet. This delivery sheet should detail the name of the patient who they are delivering to and the number of items per sealed bag for the patient. This is important to note due to audit purposes. And to end with just a quick word on insurance. We can confirm that the NPA members and customers and volunteers enlisted will be fully indemnified by NPA Insurance Limited against professional and public liability third-party risks and claims in accordance with the professional indemnity and public liability policy it issues to policyholders. NPAI's professional indemnity insurance will cover certain volunteers to deliver all classes of medicines and devices at the discretion of the responsible or superintendent pharmacist, subject to the twofold conditions that you can see on the screen. This is that the volunteers must have read and signed the delivery SOP, and the volunteer must provide a valid DBS certificate. If none of the above conditions are met and the volunteer is referred through a scheme such as the NHS Volunteers Responder Scheme that I referred to earlier, then they will only be covered if the RP or superintendent is fully satisfied that the volunteer is of good character, they have a valid DBS certificate, and they have read the pharmacy's delivery SOP. If they are not satisfied of this, then they will have to rely on the indemnity provided by the Coronavirus Act 2020 in the event that a situation gives rise to a claim. So the purpose of this webinar was to provide you with a bit of guidance on employing volunteers and delivering during the COVID-19 pandemic. Thank you very much for listening to this webinar. We hope you found it useful. We will now be happy to answer any questions that you may have.
Okay, thank you very much for that, Shaf. So yeah, as Shaf mentions, we'll now go on to some questions. So thank you all for sending in your questions. We've pulled together some of the common themes of what's being discussed, or sorry, what's been asked. So I will now put a couple of those questions to our panelists and presenters for you. So the first question we had, Helga, if I come to you, how do I go about ordering further PPE supplies? All the wholesalers appear to be out of stock.
Thank you, Simon. I imagine this question is for England, is it? Because we have some responses also from Scotland and Northern Ireland as well. So in England, we have been instructed to order PPEs through our wholesalers, and we have been assured as early as about an hour ago that wholesalers have just been given, they mentioned the two main suppliers, but they obviously didn't give any names, so I imagine you all know who we're referring to. The two main wholesalers have been receiving new stocks in their warehouses as of tomorrow. So we've been assured that is the case. So in England, that's where you can get your PPE as of tomorrow. I don't know if we've got any further builds from Scotland and Northern Ireland, Simon.
Yes, we have. So just some information from Janice to say that 2 boxes of 50 masks are going out with Alliance tomorrow or Friday. So for members in Scotland, just to keep an eye out for that. Okay, I'll go on to the next question we've pulled out then. Does a responsible pharmacist need to be present in the pharmacy premises over the Easter weekend? Helga, could I come to you again on that?
Yes, is the short answer. So the regulations still hold. Every time you are open, responsible pharmacist needs to be on site each time you are open. In this case, again in England, for the 3 hours on Friday and the 3 hours on Monday. If, of course, there's consequences and you're not able to open, we have been directed to your regional NHS local teams to be able to make an appeal in that regard. But yes, in short, the supervising pharmacist, the RP, must be on site for all the pharmacy services to take place during your opening hours.
Fantastic. Thank you, Helga. That's very clear. Just actually going back to the mention of Scotland, just a bit more information that Janice has provided us in regards to funding. So it's £700 for a half day for Easter opening and £1,200 for a full day, and a premises payment of £700 per pharmacy, just to clarify that. Okay.
Oh, and Simon, we've just been...
Oh, yeah, please, sorry, yeah.
Simon, sorry. We've just been told also the England payment. So on the Good Friday and the bank holiday, it will be £250 per hour. So it'll be £750 per day for the total of the 3 hours that we've been requested to open. And we've also been informed that further detail as to how we claim this will be sent to us in the fullness of time. Again, as soon as we get it, we'll be signposting it onto our COVID-19 webpage.
Great. Thank you very much, Helga. Okay, another one here. So my pharmacy in England was not supposed to be open. Will I have to open?
So the direction is that yes. However, as we already mentioned, if there is situations that you are unable to open, please appeal to your local NHS teams, putting in a claim that you cannot open and have that dialogue with them. We have the details again on our webpage, and if you just bear with me, I'm not sure if I have the details here available on a note. Simon, no, but you can, as I already mentioned, you can apply to receive an exemption from your local NHS England teams.
Okay, thank you, Helga. Okay, so another question here. Hold on a second, sorry. GPHC guidance stated that in an emergency, if the pharmacy cannot get a pharmacist, they may still open and be able to give out bagged up prescriptions. Can you, Helga, what are your thoughts on that?
So again, I refer you to the GPHC guidance, which basically says in an instance of an emergency. So this is either when the pharmacist is either running late, or there are difficulties in getting to the pharmacy, or your pharmacist has really opened and because of an emergency they needed to go, or something has obviously happened. We're talking about a pandemic situation. And it's only in these instances that we are advised by the GPHC that you can give out an already checked and bagged prescription. This does not mean that you can open the pharmacy without a pharmacist. Please recognize the difference, and I refer you again to the guidance sent jointly by GPHC and PSNI on the 18th of March. It's only exceptional circumstances. Responsible pharmacist still needs to be on the premises.
Fantastic. Thank you, Helga. I think from what I say, I mean, there's lots of other questions, but we are nearing the end of our webinar. Helga, is there anything else that you wanted to add from what you've heard today, other questions that have been asked by the audience? There's a lot of comments, I think. Sorry, go on.
Sorry, I've seen quite a lot of questions here about the delivery service. In a nutshell, what we have been told tonight in England is that this is a service for those shielded patients, i.e. who cannot come out. You will be paid a sum of money. Again, the details we understand are coming out tomorrow as an essential service, in that we need to ensure that that prescription gets to the patient who we know is shielded. We also understand that the summary care records will now carry a flag where these particular patients will be flagged up to us as well. So that's part of the essential service, get a payment. And then if, of course, we can't get the delivery to them through our normal services or even another nearby pharmacy, we can avail, if we wish, of the new advanced service, hopefully to be announced tomorrow. And then as soon as it's announced, it can commence on the same day it is announced, so that you will get paid when you deliver to these particular patients, i.e. the shielded patients. So the advanced service, we understand, will only apply to that shielded population, which is about 1.2 million. Of course, we recognize that there are many patients self-isolating where you're going to have to deliver their medicines as well. Please continue to record this because this becomes a pandemic, a COVID-19 cost, and we will continue to raise this with NHS England. But the new service, the advanced service, is only in regards to those shielded patients. We also have been asked about if you can backdate it. As we understand it, we know, but we will ask the question regarding that. And there's another question around whether the volunteers through the Good Sam app are going to be DBS checked. As we understand it from the guidance issued on the 2nd of April through healthcare professionals by the NHS England, those delivering medicine will not be DBS checked. So again, we are reviewing our policy in that regard. We have issued our interim NPA policy in this way, but we will continue to review it once the service specs come out and further detail is applied. So I hope that makes sense and helps to answer some of these immediate questions that we have received following the Keithridge webinar. Any questions you require further clarity, as I say, please write to us at the NPA email, the pharmacy services email, and we will endeavour to try and get our responses out as quick as possible. We have a fantastic team who are collating quite a number of FAQs regularly and in our daily emails. So this is where you will see most of the answers of the questions that you have posed tonight. Thank you, Simon.
Excellent. Thank you very much, Helga. So yes, I think just to reiterate, thank you all for your questions. We haven't been able to answer all of them tonight, but we will, as Helga says, take these back to the team who will be on them and providing answers to them, which we can send out to you by email. But yeah, I think that just leaves me to thank you all for joining us. Thanks to our panelists, our question takers, and our presenters this evening. But unless there's anything anybody wants to add from the team, I will close it there. Okay, so thank you all very, very much.